Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, friends, coworkers, and colleagues to listen to the show. If you have a question or an idea for a future program, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. This week, I'm answering the question caregivers ask: how to make sure your elderly parents are healthy. Much of the advice you're about to hear also applies to family caregivers, who may eventually be the persons who need care. While we often take good health for granted until something unexpected happens, being healthy must be a lifelong focus if we want to be active into our 60s and beyond. When you think of it, much of your life depends on the body you occupy and the things that occupy your time each day. What's your daily schedule? Do you get up and go to work? Do you take care of children at home? Do you work and have children in school? Are you retired? Everything that you do requires using your body and mind. So, what happens if you don't feel well? You're probably not as productive or as active as you might be, right? Yet we don't often think of life in our bodies this way. We assume that our body will do what it does every day, what we want it to do every day, until we have a health issue that causes problems. Depending on how and where you were raised, there might not have been any education about eating healthy and the benefits of exercise. Because when we're young, we don't think about this unless our parents teach and reinforce these behaviors. Or we become knowledgeable about the importance of the steps it takes to remain healthy. So as caregivers interested in answers to how to make sure your elderly parents are healthy, there can be a lot to learn, including unhealthy habits to unlearn. Let's talk about number one, which is vaccines. Vaccines, due to COVID, have gotten mixed results. They're controversial. Yet when you think about it, if you have children and you're a parent, you likely ensured that your children received all necessary vaccinations. Then what happens? We grow up and we forget about keeping our vaccinations up to date because we don't go to the doctor every year for checkups. And sometimes we don't go to the doctor at all unless we're sick. When we age, vaccinations all of a sudden become more important because the body has aged and maybe chronic health issues like high blood pressure, diabetes, or other conditions exist. Research confirms that vaccines are not as effective in elderly adults who have a lot of health conditions. If you followed COVID, you know that persons with diabetes or breathing problems are more susceptible to the virus. So if you or your aging parents are 60 years or older, what vaccines should you have? Here's a list: hepatitis B, shingles, pneumonia, an annual flu vaccine, Tdap, which is tetanus, diphtheria, and pertussis, if you hadn't had this vaccine in the past 10 years. If you travel, there may also be other vaccines to consider. For some reason, we're all really good about getting our childhood vaccines, probably due to our parents, right? And then we go on with life and forget that we may need boosters for some of these vaccines throughout our lifetime. Number 2, for how to make sure you and your elderly parents are healthy is dental care. Now you might wonder, why is it so important to take care of your teeth? Dental care goes both ways. Chronic diseases like high blood pressure can raise the risk of developing gum disease, diabetes, arthritis, kidney disease. Breathing problems like COPD and bronchitis can be linked to bacteria in the mouth. If you smoke, smoking negatively affects your teeth and the tissues in your mouth. Inflammation in the body from being overweight can result in gum disease. Conversely, bacteria in the mouth from infected teeth or gums can be breathed into the lungs. For many elderly, this happens, and it results in respiratory infections like pneumonia or bronchitis. Bacterial infections in the mouth from infected teeth and gums can also cause sepsis, which is a very serious infection in the blood that can be life-threatening. For all of these reasons, seeing the dentist every 6 months for a checkup and getting your teeth cleaned is very important. Admittedly, if you don't have good dental insurance or insurance at all, this is something that you should budget and plan for. You only have one mouthful of teeth. Taking care of them by brushing and flossing twice daily can help avoid cavities and gum infections. And it can make your dental appointments more pleasant because the dentist isn't going to find a lot of problems. I don't know anybody who likes to go to the dentist, me included. I had to learn this hard lesson on my own. When I was young, my parents were not good about making me brush my teeth or even floss. So at a young age, maybe I was 10 or 12, I had a mouth full of cavities that I had to have filled. Since then, I've been very proactive in taking care of my teeth to avoid more cavities. So for elderly parents or anyone, how do you know if you have a dental infection or even a bad tooth? Any sensitivity to hot or cold can indicate a tooth is going bad. Obviously, pain or any swelling in your mouth, especially when biting down, can be a concern. Constant bad breath can mean a gum or tooth infection. The best advice? See your dentist every 6 months for an exam and teeth cleaning to prevent potential issues. Your long-term health will thank you. Number 3, to make sure your elderly parents are healthy is bone health. Elderly adults who experience falls or fractures have a more challenging time managing physically. For example, they may not be able to walk as well after fracturing a hip, or may have problems using an arm if a fracture or a shoulder problem occurs. Shoulders take a long time to heal. This inability to easily perform normal activities of daily living can then snowball into many other health issues. For example, let's say your mom or dad was physically active, but now they don't get around as well because they fell. What happens is they may start limiting their activity because of pain or because of fear of having another fall. What happens when you stop using the body? The body becomes weaker. When the body becomes more fragile and parents begin sitting all day when they were previously active, it's more likely that one health concern will cause another. So, heart disease turns into diabetes, kidney issues, and so on. After age 50, Getting a bone density exam can tell you or your aging parents if your bones are strong or weak. If weak, taking calcium daily and participating in weight-bearing exercises like walking is the solution. Staying healthy and physically able helps older adults remain independent and live at home, which is what we all want to do. Nobody wants to go live in a nursing home or a care community if you don't have to. So, if remaining self-sufficient and independent is your goal, regardless of your age, you must schedule time daily to work on your health and participate in physical activity. This isn't optional. If you have elderly parents with many health issues, you likely see the challenges they're experiencing in their daily life. Parents may have problems walking, taking a shower by themselves, standing from chairs, getting in and out of a car, walking through a grocery store. They may get tired just from standing. All of these issues are preventable if you become educated and knowledgeable and start early in life to make time to work on your body to ensure it stays strong. This takes us to number 4 for making sure your elderly parents are healthy. Beginning between 30 and 40, that's young, unless you make an activity plan, your body starts losing muscle mass and physical strength. The combination of these issues translates to being diagnosed with health concerns and doing less physically and becoming tired more easily. You've seen the signs with your parents. You know your body. Use it or lose it. Losing it is the path the body takes, unless you do something to change that. Making time for a combination of cardio heart activities, like walking, running, cycling, going to the gym and working out on the cardio machines, plus using weights to maintain your strength, makes a big difference in energy and activity levels. People who exercise feel better, look better, have more energy, don't age as quickly. Exercise is good for the mind and body. Being physically active can also prevent many health issues that begin to crop up in middle age. Number 5, for ensuring your elderly parents and you are healthy, is seeing the doctor for an annual checkup and blood work. Many conditions like high blood pressure and diabetes aren't always noticeable. You could have both and think you're in great shape, but be surprised to learn by having blood work drawn that you're diabetic and you have high cholesterol and high triglycerides. These are health conditions that sneak up on many people who were not educated about the importance of seeing the doctor every year for a checkup. If you feel healthy, you might think, oh, it's such a hassle and it's an expense to go to the doctor. The benefit of doing so, whether you are a family caregiver or a middle-aged adult, is that you're giving yourself the gift of time and prevention. If you discover health issues when you're young and they are early, you may be able to reverse the health condition by changing your exercise habits or diet. You get to choose. But if you wait and you're not proactive or knowledgeable about your health, if you don't go for annual checkups or blood work, and then all of a sudden you become sick and have to go to the doctor, you probably have missed the opportunity to reverse a health condition that you may now be permanently stuck with managing. Now, this isn't the end of the world. It happens to a lot of people. There's still a lot that can be done if you make the choice to be proactive. So let's talk about attending doctor appointments for a few minutes. Doctor appointments are not one-way appointments. If the doctor gives you information and you don't understand, speak up. If the doctor talks to you about your blood work readings, ask questions. What does the number mean? How serious is this? How can I decrease high cholesterol, triglycerides, or blood sugar? You control your body. It's yours. You have to live in it for a very long time, for the rest of your life. If you don't feel well, or you can't do the things you did 6 months or 5 years ago, that's a problem. If the doctor prescribes a medication, ask why. Ask about the long-term effects of taking the medication. Ask about the side effects. You can never ask too many questions about your health because this is the way to learn. If you're hesitant to ask questions or you have a language barrier, take someone with you to the appointment who can help you ask questions. The reality is, you know your body better than anyone else. You must be honest with the doctor about your daily habits and activities. The doctor uses this information to diagnose and treat and help you. So it's important not to hide information because you feel embarrassed. If you do that, the doctor may not treat you correctly. The relationship you create with your doctor is significant to how you feel and to the care you'll receive. Unfortunately, too many people don't participate or ask questions of their doctors. And then they have more health problems and wonder why. You must be active in caring for your body and your health if you want to feel good. I know this may not be something your parents taught you when you were young. You may have to learn this on your own the hard way like many people do, but it's okay, you can do it. The same goes for having an elderly parent hospitalized. If you've never been in the hospital, it can be hard, if not impossible, to imagine what it's like. Let me paint a picture for you for how to make sure your elderly parents stay healthy. Mom or dad gets sick and they go to the hospital emergency room. They're admitted for a health concern. Immediately, blood tests and other x-rays, CT scans, or MRIs or other tests might be run to diagnose what's going on. Mom or dad are given IV medicines. Then the doctors might order medications or injections. This is the time to ask what you, if you are the person hospitalized, are being given and why. Or you ask questions for your elderly parent. Here's the reality. Doctors write orders. Nurses in the hospital follow the orders. They don't ask why unless you start asking questions. The orders of medications or injections may not be right for you. While you may want to believe the doctor knows best, you know your medical history the best. Something they prescribe may not agree with you. It could give you an allergic reaction. It could make you feel worse. Maybe you've had allergic reactions in the past. Or, most commonly, they want to give you or your elderly parent heparin injections. Heparin is used to prevent blood clots from forming in people with certain medical conditions or who might be undergoing procedures that increase the chance that blood clots will form. This injection thins your blood. Heparin injections have a lot of side effects. If you or your aging parent are relatively healthy, even though your doctor may write an order for heparin injections, you may not need the injection. It's case by case. Start asking questions. Each medication prescribed can cause side effects that may then require another medication to solve the problem. Having chronic health issues and taking many medications is a slippery slope that can make you feel worse instead of better. I'm not saying that doctors don't know what they're doing, but they order many routine things when patients are hospitalized. Know that you have the right to ask questions and to say no. Add to this, your elderly parent who is hospitalized is going to be sleep deprived. Now, you might think the hospital is the place to go and get some rest. Well, that's not true. The nurses are ordered to take vital signs every 4 hours around the clock. This means that if you are a hospitalized patient, you don't get to sleep through the night. You don't even get to sleep through the day. Plus, if you're on IV fluids or antibiotics, these may have to be changed frequently. So in addition to the vitals, you have nurses coming to interrupt you for other things. So you or your elderly parent in the hospital may only get bits of sleep here and there. And while there's no substitute for being hospitalized to treat urgent and life-threatening conditions, it's not a comfortable place to be for anybody. And if your parents can't ask questions and advocate for themselves, you must be the one to show up, get on the phone, ask all the questions. More on how do you make sure your elderly parents are healthy after a short break. As a caregiver, you don't have to do it all. Caregiving doesn't have to be a do-it-yourself job. This podcast, The Caring Generation, answers questions caregivers ask me. The podcast is available worldwide on my website and your favorite podcast and music apps, including Apple, Spotify, Spreaker, and more. This is Pamela D Wilson, caregiving expert and elder care consultant on The Caring Generation. Stay with me. I'll be right back. This is Pamela D Wilson, caregiver expert, advocate, and author on The Caring Generation. Check out my website, PamelaDWilson.com, where you'll find my online caregiver program, book, The Caregiving Trap, my caregiver blog, this podcast, and my caregiver library. There's something for everyone at PamelaDWilson.com. Let's return to how to make sure your elderly parents are healthy. Before the break, we were talking about the benefits and risks of being hospitalized. Making sure your elderly parents are healthy means that you may need to pay more attention to mom or dad after they're hospitalized if they've been laying in bed for any time. For older adults who are physically weak and have health issues, time in bed can result in more physical weakness. So a parent who is hospitalized may return home, be more tired because they didn't get any sleep in the hospital, and physically weaker than when they first went in if they weren't in top physical condition before being hospitalized. So there'll be a bit of work and a commitment for mom or dad to exercise and regain their strength if they want to improve. Hospital stays emphasize the importance of being as healthy as possible every day of your life. You never know when you might be in a car accident or have an unexpected health concern that throws a curveball into your daily schedule. These things happen even to the healthiest of individuals. You can prepare for unforeseen health issues by being as healthy and strong as you can every day of your life. Being healthy and strong take time, attention, and focus. It's easy to get lazy and say, well, I don't feel like exercising today. I'll take a day off. But you've got to motivate and push yourself if you want to be healthy in middle age and later life. There's no other option. The earlier you recognize this, the earlier you can take action. Number 6 for how to make sure your elderly parents are healthy is to monitor their social activity and mental and cognitive health. All 3 of these go together. You might even notice this for yourself. You feel and do better when you spend time with friends and you're physically active. Your mood is better. Your outlook is more positive. You probably enjoy some really interesting conversations. You do some fun things. Social isolation can result in mood and depression concerns, which over time can have a negative effect on memory for the elderly or really anyone. Making sure your elderly parents are healthy means finding ways to support their interactions with others. Whether you're investigating senior center activities and hobbies or making it easy for parents to see their friends, efforts in this area will reap positive health benefits. Research confirms that people who are socially active are healthier and live longer. Family caregivers who become socially isolated, feel alone, hopeless, or depressed are more likely to experience health issues. You may be seeing this in your own life. So, the activities and recommendations you make to your elderly parents also apply to the life of caregivers. Everything we're talking about here today is suitable for persons of all ages, whether you're 20, 50, 80, or 100. There's no sugarcoating it. Being healthy takes work. You have to commit. Number 7 for keeping your elderly parents healthy is noticing changes in condition. Now, the term change in condition is a term used by healthcare providers. What does it mean? It means that caregivers must be able to notice even the most minor changes in health or activity of an elderly parent, because these small changes can be the beginning of a huge health concern. For example, your parent doesn't have an appetite for a day or two. Their stomach hurts. They have a fever, a cough. They don't want to get out of bed. Any of these could indicate pneumonia, a stomach issue, or some other serious condition. When these changes happen, get on the phone, make a doctor appointment as soon as possible. Or if the change is severe, take a parent to an emergency care location or to the hospital. For the elderly, paying attention and catching these issues early can mean the difference between getting treatment for your parent and having them return home versus avoiding a hospitalization. As we talked, hospitalizations are risky, especially for older adults. If you can have a parent treated and avoid a hospitalization, that is the best case scenario. Number 7 for making sure your elderly parents are healthy is learning to manage multiple chronic diseases. If you're already a caregiver devoting 20, 30, 40, 50, 60, 70 hours a week of care to your parents, it's pretty likely that your parent has several health issues that you're managing. To do this well, attending medical appointments with your parents is essential to learn about all the diagnosis, the short and long-term consequences, what medications are prescribed, and why. When you become an advocate and you're proactive about health, the health of your elderly parents will become more manageable, and you can avoid surprises and unexpected situations, or at least you'll know how to manage them better if they happen. You'll get to know your parents' doctors. You'll become comfortable asking questions and presenting facts. You'll become familiar with your parents' medications, and you'll probably even get to know the staff at the pharmacy. Managing the health of aging parents is an excellent education for caregivers that can help you learn how to take better care of your health. You'll learn advocacy skills you never knew existed. Number 8 for making sure elderly parents are healthy is being attentive to all of the regular screenings. So, like we talked about earlier, with vaccines that should be investigated for persons over age 60, there are screenings that benefit everyone. Examples include colonoscopy, blood work testing for cholesterol, triglycerides, high blood sugar, bone density exams, well-woman gynecological exams, mammograms, hearing tests, annual vision tests, dental appointments, and more. In addition, if your parents have certain medical conditions, additional screenings may be ordered for them. So, for example, a CT scan to monitor spots noticed on the liver or lungs some time ago. Keeping up with this may have you feeling like you have regular monthly visits to doctors or specialists. This does become more common with age. But if you keep up with all these, you can avoid so many unexpected issues because you can discuss preventative actions with your elderly parents and the doctor. Now, there may come a time when a parent says, "No more. I'm done with all these treatments and medical appointments." This is valid, and it's the right of any person to say no more, especially if the treatments aren't providing any quality of life or your parent is in a lot of pain or suffering. In this case, it may be time to investigate hospice care, also known as comfort care, instead of continuing extensive treatments that might really not have any benefit. We're all going to come to a time in our life when our body has had enough and it starts to shut down. This may happen for some people in their 60s if they have a cancer diagnosis and have been going through chemotherapy and radiation. For some, it may not occur well into their 90s if you were attentive to your health all of your life. However, regardless of your age, hospice care, if managed well by your family, can be a blessing. I know many caregivers who engage in hospice for loved ones and they're dissatisfied with the level of care and assistance provided. Like everything else, we discuss that it's really up to you to manage the hospice to communicate your needs. Hospice providers get paid a daily benefit for doing nothing or doing something. Similar to you working with doctors and hospital providers, you must make the needs known. If you don't feel you're getting the support you want, fire your hospice company and choose another. But before you do this, ask for a meeting with the hospice director and the medical director. It's your right as a family member, and you may be able to work out a system where your loved one receives the care you want, and this provides support for you as the caregiver. Now, on this topic, many hospice companies offer grief counseling. Don't feel that you have to accept counseling if you're not in an emotional place where you think it will be beneficial. I've known caregivers who felt that the chaplain or other hospice workers interfered and wanted them to reconcile years of issues that were not going to be solved in a few short sessions. The caregiver felt worse by having these people visit instead of better by hospice attempts to intervene. As with all things health-related, your involvement and knowledge of the situation are critical. Just as you get out of life the effort you put in, the same goes for your health and the health of elderly parents if you're lucky enough to learn about preventative health measures to take early in life. Never give up pursuing your health goals, whatever they are. Don't wait, or put yourself in a position where it's 12 months from now and you're looking back and saying, "Wow, I wish I would have started a year ago to take better care of my health." Thanks for joining me for this week's show. This is Pamela D Wilson, family caregiving expert on the caring generation. If you're looking for answers to caregiving and aging questions, visit my website, PamelaDWilson.com, where you will find my caregiving library, online caregiver course, Caring for Aging Parents blog, my book, The Caregiving Trap, plus an extensive step-by-step online program in webinar format to help you learn the A to Z of caring for elderly parents. Thanks for being here with me. I look forward to being with you again soon. God bless you all. Sleep well tonight. Have a fabulous day tomorrow and make the most of each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.